Hi, this is Dr. Melanie Palm, and I wanted to do a quick little demo of sclerotherapy, which is injection therapy of the leg veins when people get broken blood vessels, little spider veins called telangiectasias, and then even larger blue-green veins, which we call venulectasias or sometimes reticular veins. So we use a technique called foam sclerotherapy. So on this side, we've got 1 cc of 0.5% of something called a sclera, which is an FDA approved solution called polydocanol. And then on the other side we have air, and we actually mix this together to make a foam. And we're going to use that on a little entry point of one of these starburst telangiectasias to treat the whole spot. And I always tell patients, sclerotherapy, it really requires a series of treatments. I hope for about 30% improvement, although oftentimes we'll get even a little bit better with a single treatment. And usually over about 3 to 6 sessions, we're able to achieve about 90% clearance of vessels. And the nice thing about using a sclera is that the molecule itself acts as a natural anesthetic. So as we inject it on this patient, it should be really easy for her. She'll just feel a little teeny poke. And we're going to go for it now. So we're going to center on this little starburst right there. Can you turn just that way a little bit for me? That's perfect. And we're going to go on 3. 1, 2, 3. And you'll start to see that whole area fill. Perfect. And that's going to spread into this entire area. You can start to see that all those little vessels are treated. We'll come down here and get another one right there. 1, 2, 3. See if we can get some of this as well. 1, 2, 3. Perfect. So what you can see is it initially disappeared and kind of came back. So now the veins are irritated, and what will happen is the vessel wall interior has been irritated and will collapse, and it's basically a little collagen tube that's going to go away over time. So we're going to continue on several areas, but just so you can get a little sneak peek of what it looks like. And then I'd have the patient come back in a couple weeks, and then we'd do a final check at 3 months to see how we did with this single treatment. Thanks so much.